By now, you should have an understanding of epidemiology in general. You also know that epidemiology relies on measurements and observations. And that is what we're going to discuss in this video. Measurements form the basis of any conclusion drawn from a study. Therefore, it's important that these measurements are of good quality. Within epidemiology, we can assess the quality of the measurements with two basic principles, known as validity and precision. Precision is the extent to which a measurement is the same when repeated. In order to ensure good precision, you must carefully and skillfully undertake measurements. Imagine measuring the blood pressure of a patient during a day in the hospital. Laid out on a shooting target, your measurements could look like this. In this analogy, the bullseye represents what we want to measure, the actual blood pressure of the patient. The bullets are all in the same area. You repeatedly measured the same values, meaning that your measurements are precise. So you can conclude that your measurements are of a good quality. But did you measure what you wanted to measure? No, because you didn't hit the bullseye. And that is where the next principle comes in. Validity refers to the extent that the instrument measures what it was designed to measure. If you use the proper blood pressure monitor, your results should ideally look like this. Your measurements are precise because the bullets are all in the same area, and they are valid because you hit the bullseye. So you measured what you wanted to measure. But, as you know, perfect things only exist in theory. In reality, we may get something like this. And you might wonder, why are my measurements slightly off? Well, there could be a number of reasons. To find the underlying cause, you should try to find the error in your measurements. The errors can be in the context of validity, or precision, or both. First off, errors in validity. A measurement might not be valid due to a broken instrument, or by using the right instrument inappropriately. In this case, you possibly used the wrong arm cuff for your patient demographic. You can imagine that an arm cuff designed for children is not going to work well with adults. The measured blood pressures will be systematically lower or higher than the real blood pressure. A situation like this, where you are set to fail from the start, is what we call a systematic error. The shooting target could look like this. Systematic error cannot be identified by analysis. It requires specific expertise and should ideally be prevented. Because a persistent inaccuracy in a measurement influences the whole process of conducting a study. Alright, now let's talk about errors in precision. These errors are caused by unknown and unpredictable changes in the process of conducting a measurement. When measuring blood pressure, an error in precision could be due to the white coat effect, meaning that patients are anxious about having their blood pressure taken. This results in varying readings of the blood pressure. Your shooting target could look like this. The dispersion of the shots across the target is random. Some measurements are correct, others are not. This is called random error. In statistics, this is expressed as range and standard deviation. To summarize, the quality of measurements can be assessed using validity and precision. A good measurement is characterized by good validity and precision. This means that there is as little systematic or random error as possible.